Hi Hayden, my name is Noeko and I'll be working with Maddie as the floor nurses at the hospital for the SIM project. We will be expecting to hear a report from you on the patient you're bringing to us. We would like to know the patient's name, age, code status, vital signs, and a brief explanation of what happened and what you did for the patient. We also want to know the condition the patient was in when you arrived at the scene. Like, did you find her in a car? Was she on the ground? What position was she in? Was she laying flat on her back or was she on her stomach? Also tell us her orientation status. Can she answer any questions? We also want to know about any open wounds, swelling areas, bleeding, and if she can move her extremities or perform range of motion, so we can assess for any possible fractures, head injury, or internal bleeding. Tell us if there's any treatments you've done on your way to the hospital. Did you give her any pain meds? Did you start an IV? If so, what medications did you give her and where's the IV site? Tell us if you notice any indications of drug or alcohol use in the situation. And pretty much any other important details like her friends or family information so we can contact them and get more information, like her medical history if we need to. We would also like to hear if there's any suggestions or additional information we should be aware of to make sure the patient gets the proper treatment. In emergency situations, we really depend on your report so we can think critically and provide prompt care based on your report. So yeah, I'm excited to work with you and let us know if you have any questions.
Hi, Hayden. My name is Maddie and I'll be working with Noeko as a nurse with the critically ill patient that you are bringing in. Noeko just went over the expectations that we are expecting you to give us in report, including vital signs, a brief explanation of what happened to the patient, and any interventions that you gave to the patient while out in the field with them, and then also the current condition of the patient as you're bringing her in, and then their orientation status, like do they know who they are, where they are, or how they got there and what happened, and then any wounds the patient may have. And then as the role of the nurse for caring for the critically ill patient, we'll be collaborating with all the team members of the healthcare team. We'll be responsible for administering any medication, monitoring the patient for any alterations in their status. We'll also be doing possible ventilator or tracheotomy care if needed for the patient, and then we'll also be doing any IV insertion and infusion and cath care. And then as the nurse, we'll be demonstrating effective communication with all members of the interprofessional healthcare team about the patient's status, if there's any change, or if the doctor needs to know anything, we'll be updating and communicating with them about that.